Hello and welcome to episode 13 of the Dental Realist podcast. We appreciate you joining us. And I am Dr. Ryder Waldron, one of your hosts. And as usual, I'm joined by my good friends and co-hosts, Dr. Troy Stevens and Dr. Marcus Neff. Troy, how's it going tonight?
Going pretty well. Yeah, nice and warm out here in southeastern Idaho.
Yeah, it's plenty warm
today.
here. Plenty warm all around. We're in a heat dome I saw in the news today. So
A heat dome.
Dome of heat.
yeah, sounds cool, doesn't it?
It does.
Well, Marcus, how are you doing tonight?
I'm doing all right. Just sitting in my nice, cozy home, air conditioned, and
Rub it
enjoying a
in,
little
rub it in.
relaxation.
If you didn't know, Troy's air conditioning went out today, so
Yes.
he's sweating it.
Yep. I hope my computer doesn't overheat as we're doing this.
Are you sitting there with your shirt off, Troy?
I do have a shirt on, but I might melt here in just a minute.
Well, with this being episode 13 and Marcus being a Miami Dolphins fan, I was thinking we could probably subtitle this the Dan Marino episode. Wasn't he number 13, Marcus?
Yes, and
Yeah.
in my eyes, he was number one.
Yeah, well, yeah, number 13 in your program, but number 1 in your heart.
Yes.
But what I'm hoping is we don't follow Dan's career and peak really early and then go on a steady decline after that.
Oh. We
can only hope.
We could have a whole other show on the quarterbacks of the NFL.
Yeah,
Well,
that would be controversial, wouldn't it?
It could be. It could be. Well, tonight we are going to be referencing an ebook from Imtiaz Manji, who is the CEO of Spear Education. It's called Trust and Value, a field guide to today's dental patients. And we're going to talk about the trust that patients have in us as dentists and how they value us and whether they value us or not, I guess. In the past, patients would go to the dentist, they'd get diagnosed, they'd schedule for their appointments, they'd come to their appointment, pay, reschedule for the recall. And guys, it just doesn't seem that easy nowadays, at least not to me, because patients will shop around. If you diagnose something on them, they might even go to the dentist down the road to see if they can save $10 on a crown or something. I had a patient that went and got some implants done in another dentist's office because he found a Groupon coupon for like a 2-for-1. So in dental school, we're trained to be great clinicians, guys. But Troy, do you remember ever having any patient communication courses at all?
I don't remember. I don't know if I was asleep during that or if we just didn't have the course. But no, I don't remember anything related to that. Everything was clinically based. There was nothing really behavioral based.
Yeah, I don't know. Marcus, do you remember any of that? Because it seems like it would be a good idea to have some of that in dental school now.
Yeah, I don't remember it. If it might have been there, but man, if it was really quick, and we moved right on to clinical stuff. So yeah, I don't remember that.
Yeah, so we at the Dental Realist Podcast are here to help you out with that.
Yes.
Let's first talk about what makes a great patient. Marcus, can you give us a little rundown from Imtiaz's book about the 10 things that make a patient great?
Yes, so he has a list that he goes through of 10 things that make a patient great. And it's kind of like a David Letterman top 10 countdown, but there's a really funny one at the end. Okay, maybe not, but they are interesting, and I think these are 10 things that all of us would likely say, if I had the perfect patient, here are 10 things that I would identify as being the things that they do consistently. So why don't we run through those 10 things, and we can comment on a few of them as we go along.
Perfect.
So number one is... and this is not counting down from 10 to 1. This is just the order that he has them in. So number 1 is they're happy and see you as helping them. Have you guys noticed that? Do you have some patients like that, or do you have a few patients that are acting a little more like they're skeptical of what you're diagnosing?
Well, I can't remember the last time I had somebody come in and say they were happy to see me, to be honest.
It's a rarity.
Unless they were in like severe pain, which I guess that happens. I don't know, Troy, what about you? You got a lot of happy patients there?
You know, I there are some, yeah, there are, but you know, it's hard because I don't really ask them this question. You know, do you see me as trying to be here to help you? You know, but you know, some people are happy. It just basically the fact that probably they're just happy individuals anyway. I don't specifically think it had anything to do with me, but ideally,
you'd like to have that patient come in, and I think all of us would, that sees you as on their side. You're there to help them with their problems, and so even if they don't realize they have a problem, they see you as their advocate, that you're there to help them identify things.
Yeah.
and help them take care of.
I think in an emergency situation, it's better than just a regular exam situation. Would you guys agree with that? Because like Ryder said, if they're in pain and you can help them get out of pain, they're going to be happy. They're going to be, seeing you as helping them. However, during an exam, when you tell somebody they have 5, interproximal caries, lesions, they're not that happy. I don't know. What do you guys think?
I agree. And, ideally they would be seeing us as helping them avoid root canals and crowns in the future by catching the cavities when they're small. But it just doesn't seem like that's the case, because more often than not, you get it doesn't really hurt. Are you sure? Are you sure there's a cavity there? Mm-hmm. It doesn't really hurt.
Yep, absolutely. Yeah. That happens all the time.
How about number 2? They've overcome their fears by embracing how dentistry has evolved. What do you think about that, Ryder?
I think that is fairly common, I guess, because you hear the patients a lot that say, "Oh, I remember going to the dentist as a kid. They wouldn't even numb you up, and they pull a tooth without being numb. You had a root canal done without being numb." And so, in cases like that, yeah, I think older patients do see it as more evolved now. We're not quite the butchers that we and the masochists that we used to be, but still people don't. There still is that dental fear involved, I think. What about you, Troy?
Yeah, I agree with that. I think the older generation, your elderly folks, can definitely see that there is a difference. That things are a lot more comfortable. The other thing is, I think that those folks are a little more they're used to having some discomfort in their life. They've been through hard times. They haven't had a cakewalk their whole life. These younger folks, the new generation, even folks even my age in their 40s, they are sometimes really, really fearful of the dentist. They're really wussies in the chair. They can't handle anything that's uncomfortable to them, it seems. It seems the older generation didn't have that wussy syndrome like we have now.
Well, yeah, I think that's totally true. They lived through World War II.
I mean, you guys, I know, right? We've mentioned this before on the podcast. Is that how many 30 and 40-year-olds do you have coming in with their wife or their husband and holding their hand because they're so freaked out? Yeah. It's like, I mean, it doesn't happen all the time, but it does happen on occasion where you're like, wow, you can't just get your teeth cleaned by yourself, huh? That's bizarre.
Yeah.
It's true. And that's not the ideal patient. I mean, that usually makes it a little more uptight when you're in the operatory and you've got another person kind of hovering and watching what you're doing and telling your patient everything is going to be okay when it's going to be okay. Yeah. So, I mean...
It just adds stress to us, So for Imtiaz's point, if they have overcome the fears and embrace how it's evolved, that is a great patient, yes. However, there are a few out there that are not so great, and if they're the opposite of that, they can be quite stressful.
Very true. Number 3 in the top 10 things that make a great patient great. They want to have a healthy mouth and a great smile.
I think most people want to have a great smile. I think if you asked most people, they'd want to have the Hollywood Brad Pitt smile. The healthy mouth, I guess if you asked them, point blank, yeah, they would say they do want a healthy mouth, but at what cost? Do they have to come in every 6 months? Because if they're, if it's a little periodontal disease versus coming in every 6 months, some of them might pick the perio, to be honest.
Yep.
Yeah, and a lot of patients don't realize that their mouth isn't healthy because there are a lot of dental problems that can, it can take a little while before they actually start to hurt. Periodontal disease doesn't hurt until it's pretty advanced, usually.
Absolutely.
Most cavities, even though they're clinically there, they need to be treated. Until they're a little larger, they tend not to notice that they're even there or feel any symptoms.
Yeah. Absolutely.
How about number 4 in this list of 10 things that make a great patient great? They trust you and accept your recommendations. Do you feel that, Troy, in patients generally that they trust you and accept your recommendations?
I think that they, as time goes on, and I've seen them year after year after year, yes. Seeing a new patient for the first time, I don't know. I have a hard time sometimes. Some people you can read, some people you can't. But, you do have those folks, and we track them, when you have the unscheduled treatment monitor, where you basically have treatment planned, some restorative work on someone, and for whatever reason they don't do it, whether it be financial or they just don't believe they have a cavity and you're just full of it, kind of thing. But I do think that over time that you definitely can get more trust, but some people it takes quite a few years before you can get there. New patients, sometimes it's a little tricky.
Well, what I like to go back to, guys, is people don't care how much you know until they know how much you care. Those are words I live by.
Can I write that down?
You could put that on some vinyl lettering and hang it on your wall.
Is that in one of our books?
Yes.
Probably.
I mean, we really should have put that in one of our books.
I think G.V. Black came up with that.
Oh, did he?
But, I mean, when you look at, like, the most trusted professions in the world, or in America, whatever the list is, dentistry is usually right at the top. And there are times when, I'll diagnose something and I'm not sure what's going through the patient's mind because I feel like they think I am just totally lying to them. And I'll show them on the x-ray, everything I can do to prove to them that they have a cavity. But a lot of times I just feel they're not buying it. And it kind of stinks because then, the next time you have to diagnose something, you get a little bit gun shy and a little bit nervous about how's the patient going to react to this.
Yep. Well, didn't you have a patient that you recommended a crown on just, what was it, yesterday or today, that said, yeah, I'm just going to go buy your boat or something like that?
Yeah.
So you can kind of see that she's not really trusting because she thinks that you have an ulterior motive, that you're trying to get a boat. It's not like she needs a crown. It's that you need a boat, which is sometimes the perception of the people.
And I don't like open water, and I can't swim, so there's no chance I'm buying a boat ever.
You can't swim? I thought little babies learned how to swim.
Little babies can. Grown men can't.
Grown men named Dr. Walton cannot.
I mean, I could stay afloat for a while, but if I got out in the ocean, I'd probably just duck down and just say it's over.
That's terrible.
Take a big swallow of water.
Just be done with it,
Just call it good. I'm not going to waste my energy out there.
I did not know that you could not swim. That's terrible.
Let's go to number 5 in this list. The patients come back when they're appointed. It's probably kind of an obvious one. Why that would make a great patient. Any thoughts on that one, guys?
It's obvious, but it's not that simple. I mean, how many no-shows do you get each week or each day? And the problem starts when you can kind of predict which patients are not going to come back. They'll make the appointment. We're going to talk about some different patient characteristics later on, but when they're going to schedule an appointment, but you also know they're not going to come back. I mean, that's kind of a pain.
Yeah. It's very difficult, especially on a short notice, to fill a schedule. If someone no-shows a 3:00 appointment, by the time you can even get anybody in the chair, usually your next patient's there. So basically, it just hosed you out of all that production that you would have had. But those folks that come to their appointments or give you at least a decent notice before, a 24-hour notice, so you can actually fill the schedule. Those people are awesome.
Yeah.
That's the kind of patients you want, and that's kind of leads into number 6. We've already kind of talked about it a little bit here, but number 6 is the patients don't cancel, no-show, or arrive late. That obviously makes a great patient.
Yeah, and sometimes the ones that arrive late are worse than the ones that no-show. Because we've talked about before, one of the best things to do to build a practice is to stay on time. So your patients can predict that when they walk in that door for their appointment, they're going to be seated. But if you got people arriving late, man, it really sets you back. I told you guys this week I had a patient arrive 2 hours late, and I'm like, and it just worked out. Well, I mean, they arrived 2 hours late. The patient that was supposed to be there when they arrived actually no-showed or canceled, so it actually worked out. But that's not real typical for that to work out in your favor.
Yeah, usually that means you just have an extra patient that you have to somehow squeeze in.
Yeah.
Or you have to tell them, sorry, we had that time and you didn't show up. But, in an emergency situation, that's really hard to do because, we do have big hearts.
We really do.
And we know you care, Ryder.
And you care that I know that
you care.
You care.
Yes.
Something like that, yeah.
Mm-hmm.
Man.
Yeah. I thought it was better the first time you
just
said
the
it.
words of wisdom.
I mean, it was just unbelievably deep.
All right, number 7 in this list of 10 things that make great patients great is that they don't show up on your high maintenance list. What would you consider a high maintenance patient, Ryder?
Well, I think one that is overdue for their recalls. I mean, those are probably the top of the list because you have to pay your staff to call them to try to get them in, and you don't want to have to babysit them all, but you also have to fill your schedule. Another one would be people that are overdue on paying their bills, or they've made payment arrangements and they haven't paid, and then you've got to pay your staff to make those calls also.
Mm-hmm.
Yeah, and I think there's other things too that we could bring up. Those are great points. How about that patient that comes in and they need to sit and talk for about 20 or 30 minutes before you can ever lay the chair back and get started? I mean, that's, that patient may need that extra care, but that's a little bit of a high maintenance patient. It makes it hard to really plan the appointment and really be efficient when you're trying to do dentistry.
Yeah, that's a really complicated situation there because, in the real world of dentistry, unfortunately, you do have to pump through a lot of volume. And it's just getting worse, as we've discussed in other episodes with the insurance changes. You're almost starting to have to herd people through to make any money in dentistry. And you get these folks that need this TLC, and if you don't give it to them, they're out of there, and they're not going to be happy. And I've got one patient. She's a great lady, but she tells me every time she comes in that I'm at her beck and call because she pays my paycheck, and she's right about that. If I don't do what she wants me to do and present things in the way that she wants, she could walk, and that's just the business we're in.
That's a little bit more of a high maintenance patient.
Yeah.
She's not as easy as just coming in and
Yep.
You can give her your recommendations. She trusts you, and you move forward, and you do
Exactly.
what you need to do. How about number 8 on the list? They value your services and pay promptly. Why does that make a great patient, Troy?
Well, that's because they see what we do as helping them, which kind of goes back to number 1. I think if you find value in something, then you'll be okay paying for it. The way you can tell if a patient's a great patient with this one that they value your services is if they don't complain about your fees. If you get people that complain about your fees, that they don't value the service to that amount of whatever it is as far as how much you're charging. And the nice thing about people who pay promptly is the fact they understand that's what makes the world go round. That guess what? Money doesn't grow on trees, and dentists aren't independently wealthy, and they do need to actually get paid for their services so that they can pay their staff, they can pay their rent, they can pay the power bill, all that fun stuff too. So people who kind of understand how business works make great patients because they kind of understand that we need to pay at time of service. It's not like you can't walk into Walmart and say, hey, look, I got this bag thing full of groceries, but let me just pay you later because Walmart, is a multi-billion-dollar company. They don't need my cash right now.
That's a good point. That is a good point. And we need that we need that patient that's going to pay for our services if we're going to run efficiently, if we're going to survive. So
yeah, and to be honest, when they pay and you feel like they do value what you just provided, it makes us feel. I mean, it makes you feel good because dentistry it's tough enough being a dentist because you don't get a lot of feel good moments in dentistry, but it does make you feel good when you actually know a patient values what you just did for them and are willing to show it by paying for it.
Yeah, exactly.
Yeah, very true. Number 9 on this list is they respond promptly when contacted. Why would that make a great patient, Ryder?
Well, I think maybe that goes back to talking about the 6-month recall list when people get overdue on that. It's nice if you don't have to call them like 5 times. It's nice if you call them and if you have to leave a message and they call you right back and schedule right away. I mean, we have some patients that, they don't want to schedule 6 months out. They want a phone call or a postcard sent so they can be reminded. But it's nice when you do send that postcard and they call to make the appointment. You don't have to follow up with them a bunch of times. It does save a lot of staff time.
Yep, that would definitely be a valuable patient to have.
Yep.
Number 10 on that list is they want friends and family to experience your care. Why would that be important?
Well, that means that they like you, like we talked about, they're happy with you, that they trust you, that they value your services. It kind of ties it all in together. If they would have their children, their friends and family come see you, then that means that they pretty much think you're the bomb, which is kind of the point you want to get to, because as we know, that's where your best referrals come from, is from existing patients. It doesn't cost a whole lot of money marketing-wise to, get someone to refer friends and family to you, where, your Yellow Page ads, your internet, all that other stuff the marketing dollars can add up. So that just shows that they trust you, that they value your services, and, they want other people to come and see you. So that's kind of the best compliment you could have.
Very, very true. Good. So that list is, I think, a great list. It gives you a good idea of the kind of patient you want to shoot for, and the way that you'd ideally like to shape existing patients, get them behaving in those ways in that top 10 list.
Can I bring up something real quick? I just want to kind of touch base with you guys' thoughts too. We went over these 10 things that is the ideal patient, the great thing. Ryder, I don't know if we could throw out a percentage, Marcus, as well. How many patients do you think fall into those category? Into those categories? I mean, in your practice, how many do you think?
Yeah, that I could check the box on all 10 of those things. Or
at least the majority of them, maybe.
Yeah, I would say for me, it's been 10%, maybe as high as 20%, if I'm. But it's a small percentage.
Yeah, it's just not. That's the way in my practice too. It just seems like, I mean, there are times some that are better than others, but yeah, this is a tough list for anyone, I think, to follow.
Yeah,
I mean, what do you think, Ryder, as far as your patient base?
Yeah, it's probably the same. I mean, to check all of those things off is very low. And my patients, for the most part, are great, and I would consider most of them great patients. But as far as like ideal, hitting all of these, I mean, that's very limited. I don't even think I'd put myself in that category.
That's what I was. Yeah, that's kind of what I was getting at. Is like I don't even know if I'm a great patient.
I probably wouldn't.
No, I know.
He's a terrible patient.
I think it's clear.
He's the one that has his wife holding his hands during the procedure because he can't handle it.
My hygienist does complain that I'm not real regular on my 6-month checkups, but I brush my teeth like 10 times a day. So
you're at the office and you're late for your appointment.
Yeah, I'm late walking across the hall to get my teeth cleaned, and my building's like 10 by 10, feet. It's like a matchbox.
Exactly.
Well. Yeah, that's a good question, Troy. I hadn't really thought of that, but
yeah, I don't think it's a majority by any stretch of the imagination.
No.
That's a challenging list to check all those boxes.
Yeah. Well, let's talk about these the 4 key behaviors that Imtiaz says that these. Okay, so let me start over. Everything in this top 10 list comes down to 4 key behaviors, and the first thing that needs to happen after a patient sees us for an exam is to schedule for the recommended treatment that we suggest. And Troy, what does it say about the patient, and what does it mean for your practice when the patient says yes to treatment that you recommend?
I think that means that they trust you, and actually, it helps me also when they do schedule to realize that. They don't think that I'm trying to pull one over on them, kind of thing. It kind of helps me to relax too, because I don't know if you guys feel this, but I kind of feel this. Especially with new patients, I feel like I'm walking on thin ice all the time. I feel like, they're judging me, and I don't know if it's just my own personal limitations or something like that, but it's like they're trying to fill you out and kind of wonder, is this guy for real? Is he trying to just scam me or whatever? But if you tell them they have a cavity, they schedule for it. That, in essence, tells you, hey, look, they trust you. So, and I don't take that lightly. I mean, you guys don't either. We've talked about this before. I will not schedule something that doesn't need to be done.
Right.
I'm not going to tell someone they need a crown if they don't. I'm not going to tell them if they need a filling if they don't. I mean, we're just above that ethically. But
right.
That is a kind of a help for me to understand that they do trust me when they accept my recommendations.
Yeah, I think that's the big thing is the trust factor, and it is a two-way street between the dentist and the patient, I think. So the second thing that needs to happen after they have actually scheduled this treatment is for them to show up for their appointment. And like we mentioned earlier, that sounds simple, but it's not that simple. Marcus, what are some of the negatives besides lost revenue, obviously, of a patient not showing up for their scheduled appointment?
Obviously the lost revenue that you weren't going to get, but it just kind of, I don't know, it puts a weird funk on your day. I don't know if that's the right way to put it. I kind of like
I like that too.
Yeah, your staff is kind of in limbo, waiting for you to tell them, okay, well, now what do we do? You just kind of feel sometimes like, well, okay, what can I do that's more productive right now? It just kind of throws the day off when a patient doesn't show up.
Yeah, I think that's a great point because in a lot of offices, you have production goals and things like that. And when a patient doesn't show up and you're not getting that production, well, sometimes the staff gets down about that. They get worried, well, are we going to hit our bonus or, goal or whatever? And so, yeah, I think it does put a little funk in the system there.
Yeah, and your front desk just starts going into panic mode. They're they're trying to fill the schedule, but like we stated earlier, if somebody just doesn't show up for their appointment, it's nearly impossible to get someone that could make it down to your office in time to make the day stay going smooth. It would, the person would come down, show up, 10 minutes before the next patient's supposed to be there. You still got to get them numb, whatever you got to do. It's a challenge. It really throws a wrench in your day.
Yeah, sometimes it's better just to take the hit and just move on and not make a big deal out of it. But yeah, you're right. The front office does go into panic mode, and you can feel the stress of the rest of the staff, and it makes for kind of a bad situation.
Yep.
Well, the third behavior, third thing that needs to happen is the patient has to pay for today's treatment. Now, Troy, how do you ensure that the patient will pay, and what does it mean when the patient pays as arranged?
Yeah, what we do is we have our chairs that we tip upside down and we shake them. And if there's enough coin in their pocket, then we'll go ahead and proceed to treatment. If not, we'll just shoo them out the door.
We'll proceed to treatment. Listen to you.
No. Well, there are certain things, like crowns and things that are a little bit more expensive items that we will actually do a financial plan prior to having the restorative appointment even made. We require a half down at time of service on some of those things, and then full payment, the rest of the payment when we seat the crown and we're done. But if someone comes in and they're not paying their half, then we're not going to proceed. Sometimes that doesn't work perfectly well, as sometimes we know the patient really well and we've made other financial arrangements with them or whatever, they got care credit or things like that. But I think that basically when they do pay for your services, it does say that they value your services, and they think that is something that will benefit them. That's one thing that you can always definitely tell where a person's heart is. If you tell somebody that they need a crown because their tooth broke, say they busted a cusp off of a molar, and they say they can't do that because they just bought a big screen TV, you kind of know where their priorities lie, and it's not on their mouth.
Yeah, totally true.
And so if they're paying for your services, that they value your services. They know that, I need this, and I'm going to get it done.
Yeah, that's a great point. So the fourth behavior in this list is to get the patient to refer other patients to you. So, Marcus, what have you done in the past to get patients to refer to you, and how does it affect your practice?
I usually just smile at them, give them a big hug.
Troy, let me ask you what a normal person does.
Yeah,
because we know
Marcus tells
them
he's a Tom Lauer recipient, and then they just go, oh, whoa,
flashes those blue eyes at him,
bat the eyes at him.
I think you gotta be likable, and we've talked about this in a previous podcast. People need to like you, and they need to respect you as a dentist. But if they get that sense that you're genuine, that you're doing the best that you can for them, that you really care about them, I think then it's pretty easy for them to go out and refer other people to come in and see you. Doesn't always mean that it's just going to happen if you don't ask, and I think that's something that we've tried to do is find a way without seeming needy to ask our patients to refer to us. And that could be as simple as at the end of an appointment say, we sure loved having you come in today. You're one of our favorite patients, and we'd love to have more people just like you. So please tell your friends and family about us. And, if for instance, you have a program to reward patients or something like that, you can say, here's this card. You can take that, give it to your friend, and when they refer, they're going to get whatever, and you're going to get X, Y, Z. So that's kind of how I've approached it in the past.
Yeah, and I've done the same thing. We have a referral card. I think actually it's something that I kind of stole from Marcus. And it works well. We put it in their hygiene bags when they get their toothbrush and toothpaste and stuff. And and like you said, Marcus, you don't want to seem desperate, like you're begging for patients, because nobody wants to send their family and friends to a dentist that is, really struggling and not staying busy. But just an easy way to do it is to, put it in their bag, or like you said, Marcus, just mention to them that you really appreciate them. It makes people feel good to hear that. Troy, do you have any other ways that you use to get new patients in?
Yeah, we do the same thing you guys talk about. We call it a care to share program. I think we got it from one of our coaches. It was in place when I bought the practice, and basically, we have a $25. The person that refers gets $25 off their account, and the referral gets $25 off their account. And that's the kind of thing. And we track our marketing dollars. And I have found over the years that is the, by far, best return on investment we get. We've talked a little bit in the past amongst ourselves about, the effectiveness of yellow page ads and all that stuff. And that stuff really is so expensive, and the return on investment is absolutely horrible. And so we found that the Care to Share program has been by far our best way to get patients in.
I think the theme tonight is caring.
Yes. Well, with your fabulous quote, it's kind of got us thinking.
I mean, geez, this is really just going to take off.
I know. I mean,
all right.
Are you crying, right?
I mean, you guys just talk.
Let's give him a
no, you are a sensitive little fella.
Man, my baboon heart is not impervious to emotion. All right, well, let's move on. Imtiaz says in his ebook that each patient fits into one of 5 designations on a pyramid of value. So let's break down these 5 different types of patients. And I think it's nice that he actually recognizes that there are different types of patients, and he says that this isn't a science, but there are different types of patients. And I know there's some consultants and coaches, they just have a one-size-fits-all type of script to talk to each patient. And when that doesn't work, you don't know what to go to after that. But this is a kind of a nice way to break down the patient. So let's talk about the first one, which is the event-driven patient. And I think it's more commonly known as the emergency patient, even though that we know there's very few dental emergencies that are life-threatening. But they're the patients who want to be patched up. They'll choose a filling over a crown. They rarely get regular cleanings, if ever, even though their insurance pays for it. And they usually have an excuse for not getting regular treatment. Either they're scared or money's an issue. They say they don't have the time. They had a bad experience as a child. But Marcus, what do you see as the biggest challenge with this type of patient?
It's tough to convert them into a regular patient. I mean, ideally, that's what you do. You get them in, you take care of their kind of urgent need that they're wanting addressed, and you help them start to visualize what a better way forward, that they can avoid having these big urgent problems by just coming in regularly and staying on top of things. And that's a challenge. I don't know that I have, in my 13 years of practice, come up with like a perfect solution to that. Because some people just generally that's who they are and they're not going to change. But trying to find a way to get them to value dentistry and realize that everything doesn't have to be an emergency. They can come in and prevent a lot of problems.
Yeah, Troy, do you have a way to educate these type of patients and kind of stress the importance of recalls to them?
No, I don't have anything that's like earth-shattering. We call these people the necessity patient. That's kind of
that's a good one.
Because the only time they'll do anything is if it's an absolute necessity. You could tell them all day long they need a crown on a big filling, that it's going to break, but until it breaks, they will never do it. And that's what I found, like Marcus was saying, you could tell these folks, we really need to get into recare. Let's look at some of your other teeth, make sure that, they're not in a situation where they're going to come up, with a lot more problems. If we can catch it smaller, it doesn't cost so much. And you can talk to these folks, and they are just going to say, yep. And next thing you know, they'll leave your office, and you'll see them on the next emergency.
Yeah, that's a great point.
Or they'll call you on Friday night at about 7 o'clock when the tooth finally breaks.
The one that you told them 3 years ago is going to break.
Yeah, I think that's great. And one thing I try to do, I also don't have a magic formula for this, and which I think hopefully our listeners appreciate our honesty, because we really, there is no perfect way to get these patients into recall, but it's just little baby steps. I think I've tried before. If they come in for a broken tooth or a cavity, I usually mention, I didn't look at all your teeth, but I can see that there's some other teeth in there that look like they have some cavities starting. So it'd be a good idea to get in for a checkup so we can x-ray everything and check everything, and so we can prevent any of these emergencies in the future. Sometimes it works. Sometimes they say okay and then don't schedule,
or they schedule and then they don't show up.
Right. Yeah. Which is, we don't like that either. No. But so, Troy, how do you respond when you tell them that they need regular recalls and they say, well, nothing's hurting? Like, what's your answer to that?
Yeah, then that's kind of, like Marcus brought up earlier, periodontal disease doesn't hurt until it's really severe and really advanced. And so I'll explain kind of that situation. I'll say, look, there's a lot of things in dentistry that don't hurt until they're an absolute, emergency. So, a filling or a cavity generally doesn't hurt until it gets deep enough into your tooth. Then it becomes sensitive and things like this. So if we can catch them before they start hurting, that's a good thing. That's kind of the way that I try and take it.
Yeah, and if you catch it when it's a cavity, then it might save you some money from paying for a crown.
Exactly.
Or losing a tooth.
Or whatever it may be.
Right. So, Marcus, how do you deal with them when they need a crown? Say they broke a cusp on number 30. They need a crown, but they say, I can't afford it. What do you tell them then?
That can be tough, because sometimes you can go ahead and you could do a filling possibly, and I've done that where I've just explained to them, this really isn't the ideal care. I really don't know how long this might last, but it is an option, and if we can do this, but it's likely to break. I just really try to let them know that there's a lot of risks involved, but sometimes there really isn't another option, and I try to just be upfront with them and say there really isn't a better option than this crown. Unfortunately, that's the best I can offer you.
And it's more expensive, but usually in life, things that are better are more expensive. I actually had a patient recently that had an onlay that kept coming off at number 29, and I told her, you probably should think about having a crown on this. The onlay had to be it was gold, had to be several years old. And she was older. She was in her 70s, and her daughter would bring her in. And after the onlay came off a couple of times, I really appreciated that the daughter and the patient actually said, you know what, let's just go ahead and do the crown. You said we would need a crown, and it's costing this much money every time we come get this re-cemented. Let's just do the crown. It's just the better option. And it was kind of the baby steps thing. It started off as just, let's re-cement things that are not functioning that well. And it turned into a full coverage crown, which is great. So you don't want to kick these patients out of your practice at all, but if you can try to slowly educate them, then I think that's great. If you
inform them, like you guys both talked about there, I think that's the good thing to do. We've all had a patient say that, I can't afford this crown right now or whatever. So you do your best you can to do a filling on them, and and you tell them it's going to break, and then when it breaks, they'll come back. Okay, yeah, you told me it was going to break, and so what can we, let's get the crown done now or whatever. But if you kind of be reasonable with folks, usually they're pretty reasonable as well. And if you've talked to them and told them that in the future this is going to happen, they will definitely trust you, because they'll go, oh my gosh, you told me this was going to happen, and it did. And so, it's kind of nice to have some of that stuff work in your favor.
Yeah, definitely don't shame them and tell them how stupid they are for not getting a crown on that tooth and whatever. They'll never come back then.
No, exactly.
All right, guys, let's move on to the reactive patient. This is just above the event-driven patient in the pyramid. And these patients, they understand the need for recalls. They just don't put a lot of value into them. They'll be regular for a little while. Maybe they'll go 2 years and come every 6 months. And then they just drop off the face of the world after that. And they no-show fairly often. It's fairly predictable. I usually worry that these patients went somewhere else, chose another dentist, and they usually procrastinate treatment. But Troy, what do you see the biggest challenge with these type of patients?
Well, it's just challenging because I guess that you kind of know that they don't see the value in possibly coming into your office every 6 months. They may be the patient that you kind of get the feeling that they think that you're kind of just trying to, scam them or whatever a little bit, even though that may not be, in every situation. But I do find that some of these folks will do the same thing. They will fall from this reactive to kind of the base thing that we just talked about, where, they'll be on recare for 3-4 years and then all of a sudden drop off, and then they're just coming in for emergencies because they've lost their insurance or something like that. And so they can kind of bounce back and forth between these different layers that he talks about, based on their, insurance status or economic status.
Yeah, I think that's totally true. And these are also the patients that a lot of times will say, when you tell them they need to schedule in 6 months, they'll say, well, I don't know my schedule in 6 months. Mm-hmm. Now, Marcus, how do you handle that when you get a patient that says that?
I usually say, well, neither do I. I mean,
that's true.
It's true. I mean, you can say things like that, like, oh, well, now you do know. Let's get this scheduled. Or, we're gonna give you a call 2 weeks prior. We're going to send out a postcard. Those are all things that I think are pretty common to do. And for most dentists, those are approaches that you can take. But it can be tough with this kind of reactive patient because they really are hesitant to really commit. And so I think that's the biggest challenge, is getting them to commit.
All right, Troy, now with this reactive patient, when you do diagnose something on them, say they do come in for their 6-month recall and you diagnose something on them, how do you handle it when they say, I don't have time to do that? I don't know when I can come in to do that crown or that filling?
Yeah, that's a tough one because on one hand, you don't want to force them into a commitment they're not going to keep. I mean, you can schedule them all you want and they're not going to show. So oftentimes we'll put them on a call list, and basically if they, we'll keep in touch with them on a regular basis to see if we can get them. It's I don't know. That's a really tricky thing. I don't know. You guys might even have a better point to keep these people in line, to make sure that you don't want to let them drop off the face of the earth. But on the other hand, you don't want to have a situation where they're so non-committal that they're not going to be doing anything, and you put them there and they just keep failing over and over. Have you had that too with those folks? You know, it's like, this is the third time they failed their appointment. I'm tired of scheduling them, so I'll actually tell my front desk, don't schedule them again. Yeah, because I mean, we've just lost so much revenue on it, and like you say, revenue's not the only thing, but it really does. It really does cost money to run that. And when we reserve time for folks, they don't show over and over and over. It's really a challenge.
Yeah, I actually had something like this recently, and my associate diagnosed 3 root canals on 3 lower anteriors, and the patient scheduled for him. I scheduled him for 2.5 hours to do these root canals. The first appointment, he called a few minutes before and said that his care credit didn't go through, and he was a little bit scared, so he wanted to reschedule his appointment. Rescheduled it to the next week, and then he no-showed for that. And so it was 5 hours of open time that we had there, and that kills you. Mm-hmm. And then you're sitting around forever doing nothing. But, if I have a patient that I diagnose something on, just a regular patient, and they don't schedule, I'll have the front office, like you said, Troy, I'll have them pull their treatment sheet and keep it, maybe call them back in a few days when they've kind of, they don't feel so much pressure to schedule at the office, and they've kind of calmed down a little bit, maybe can make a little more rational decision and make an actual appointment. But Marcus, do you have any magic tricks for this?
I don't.
Yeah, that's a tricky one. I mean, it is. It's a really fine line you walk. Yep.
All right. Well, in that case, guys.
Yeah, don't take our advice on that one because we haven't got a clue. We're still, it's a challenge.
Remember that Dan Marino thing? This is like what? We're probably like 1994 here on Dan's career. Really, really kind of bottoming out. You see, he's never going to go anywhere. But stick with us because we're going to throw for a lot of yards.
Yes.
So our next patient is the proactive patient, which is the largest segment of your patients. It's the bread and butter of your practice.
Proactive? Isn't that the acne stuff that you can buy on?
Yeah, it is. You're
be.
right.
So, yeah, this patient will also sell you some multi-level face cream.
Yes, there you go.
Yes. So,
you'll have fantastic complexion.
They may or may not show up for their appointment. They really don't have any acne on their face. So it's the largest segment of your patient. They're kind of the bread and butter. The cost of the treatment is the biggest concern. They are committed to regular hygiene appointments, but they usually will only do what the insurance pays for. So, Marcus, with this patient, what do you see the biggest challenge being? I
think it's getting them to commit to all of their treatment, getting past that insurance mindset. They're pretty committed. They keep their appointments for their hygiene, but they just kind of they've got that mindset. They've been trained so well by their insurance that their insurance is their master. It's the one that determines what they get to do and how much of it they get to do. I've found that most of these patients actually have the resources that they could do most of the dentistry that you recommend. But they've gotten so trapped in that $1,000 or $1,500, whatever their max is. I can only go to that, and I can't go beyond it. And I've found that I've had to be really careful with my team members. Whoever has those financial discussions with them, don't approach the treatment that we've just diagnosed by telling the patient, now this is what your insurance is going to cover. So if we can get that done, and then you may want to wait till next year, because sometimes your own staff members can undermine that and train that kind of behavior in these patients. But most of these patients I've found are the people that are making pretty good money. They have a pretty good job that gives them dental insurance, so they really can do more than they realize. They just need your help to kind of help them figure out how to approach it and still get the benefit of their insurance.
Yeah, that's a great point, because that's usually how a financial discussion seems to go, is that it's, this is how much it's going to cost. Your insurance will cover this. This is your portion. And then they're like, they turn it off after they see what the insurance will cover. And I think we've talked about before that insurance needs to be discussed as a form of payment. It's like a credit card. That's a way to pay for something. It's not the absolute end all be all. And it really feels like a lot of these patients trust the insurance more than they trust us. Well, if the insurance doesn't pay for this crown, I must not need it. But the insurance is on their side, on the insurance's side only. They're there to make the insurance company money, so the patients don't always understand that. But, Troy, how do you deal with it when you tell them they need a crown and they say, well, does my insurance cover it? Because that's a common question, it seems like.
Yeah, I'll say they cover a portion of it. And then, you have to have that talk with a lot of folks, because a lot of folks will confuse medical insurance and dental insurance. They think that, dental insurance should, works the same, which it doesn't. It's more just like a supplement. It's a $1,000 deal where it buffers the cost, but it's not going to cover everything you need. And there isn't like a, out of pocket maximum to where the insurance will all of a sudden start kicking in and, pay 100% of that or whatever. So you really have to educate the folks, and also it's challenging because, like Marcus said, a lot of folks will only want to do what the insurance covers, and for some reason they think the insurance is the end-all, be-all and everything. And if my insurance doesn't cover root planing or, 3 months recalls, apparently I don't need it. So it's a really hard situation to be in, to educate them to realize, your insurance does not have your best interest in mind. They're here to give you your, little $1,000, $1,200 or whatever it is, but, you need more than this. You kind of have to tell them, above and beyond what the insurance is going to cover, and explain to them, how they can take care of that financially.
Yeah, and a lot of times, if they need a root canal, a buildup, and a crown, I mean, that'll max your insurance out right there. And sometimes if if their insurance isn't going to pay for all of it, well, they won't do it. And eventually gets to the point where that tooth is decayed so far, it has to be extracted. And then they either need to pay for an implant and a crown or like a bridge to replace that tooth, or they go without anything. And so these little decisions end up, really affecting the rest of their mouth if they would just kind of pony up and try to do what is best. It doesn't have to be like the, top of the line veneers, everything like that. But I had a patient recently that he was going to lose all of his lower teeth, and he knew he was going to. He came in for a denture consult, and it was a lower denture. So I explained to him that he should at least look into having a couple of implants placed to support the denture. And he followed my recommendation. He went to the oral surgeon, got a consult, came back, talked to me about it so we could get some impressions and stuff. And he said, I really had to, scrape some money together to pay for those implants, but he really trusted me. And he trusted me, and he was really excited about it. I think he took some pride in it that he was, putting some money back into his mouth, and the case is over now. And he just looked great, and he was happy with it, real thankful. And just, that's kind of the really great patient that you appreciate.
Yeah.
But
Yep, absolutely.
Marcus, how do you respond when one of these patients says, well, I'm on a fixed income? Because I get that question. I get that comment quite a bit.
That is a common one. And again, I think that sometimes for patients, for some patients, it's more of just I don't know if it's a test. They're just testing you to kind of see what you say. Or it's a way to put up a little barrier. But I mean, everybody's on a fixed income. I mean, there's hardly anybody that I can think of or that I know that doesn't have some max level of spending that they can do. I mean, so helping them realize that there are ways to get the treatment that they need and the treatment that they want. It may mean that they need to, phase it over time. It may mean that they need to use an outside financing company like Care Credit. But there are ways for them to get the care that they need.
Yeah, that's a good point. Well, guys, should we move on to the next patient?
Let's do it.
Yep.
I think it's a good time. The discretionary patient is the next one, and this patient is close to the top of the pyramid. Focused on appearance, they kind of self-identify what they want. They've usually seen, like a makeover show, or their friends have recommended some sort of treatment, or they have like an upcoming event, like a wedding, or something where people are really going to see them. Insurance isn't a concern. Money isn't really a concern, but sometimes they have these unrealistic expectations. They've seen, somebody get a makeover and their teeth were just perfect and everything looked great, but they don't realize that they have periodontal disease that's got to be under control first, and they've got to have a bunch of broken teeth fixed, and they've got to get a base here before you can start doing the bigger treatment. And sometimes these patients, when you tell them it's just unrealistic, they look at you like you're crazy, and they sometimes can go somewhere else. But Troy, with these patients, what do you see as the biggest challenge with them?
I think the biggest challenge that I find with these folks is meeting their expectations. Sometimes, I have a couple of these going on right now where, they're usually, kind of middle-aged to late, 60s or whatever. They're retired. They've done very well for themselves, and they've gone their whole lives kind of maybe helping their kids out or something like this more. And then now finally they've got the money for themselves and they can invest in their teeth, and they all of a sudden want this Hollywood smile or whatever. But boy, I tell you, some of these you have to really sit down with them, educate them, do wax ups and images and pictures and stuff like this to make sure you can meet their expectations. I have one lady that I actually told her I couldn't do the case because I knew for a fact that no matter what I did, she was just going to pick at it, And I think one problem that dentists have is that they just jump in. Oh man, this is going to be a great case. It's going to look great. Yeah, you may think it looks great, but do they think it looks great? Because if they're spending an astronomical amount of money on their teeth, they have to be the one that are happy with it. You could sit and tell them all day how great they look, but unless they, look in the mirror and think they look great, you're in trouble. So, a challenging patient. If you can meet their expectations, then that's great. but I am very cautious. And we've talked about this before, how some of the bigger cases, the bigger cosmetic cases, these kind of things are the ones that that just linger with you your entire career. You know, there's some that I've done the first few years in dentistry. Whenever I see these folks on recare, I'm always kind of sweating bullets to make sure they're still happy with it.
Yeah.
You know, they spend $20,000 on their teeth, you know, and they expect that to last forever, you know. And so, I don't know, they can be kind of stressful, can be kind of rewarding too, you know, to be able to see those folks, you know, smiling and happy with their teeth now, you know, that they've been able to get after all those years. But yeah, sometimes, you know, it's a challenge.
Yeah, and I think that's a great point, is that they do think that it's just one-time deal and then they're done. But if you know, do 10 crowns in their mouth, well, in 10 years, you're probably going to have to replace those 10 crowns. So if it's, you know, $10,000 now, it's going to be $12,000 in 10 years. And I think explaining that to them and getting ahead of that problem is really important. You don't want to discourage them from doing the treatment all the time, but you just want them to actually have realistic expectations and not think that they're, you know, everything's going to be perfect when it's not. Yep. Marcus, what do you see as like an upside to this type of patient?
These can be really profitable procedures. I mean, I think that's one of the big upsides to it. You know, you could do 6, 8 veneers, whatever it is, and if you do it right and you've really planned it out and you've really figured out what your costs are and you're charging the right amount for these procedures, you can really, in the end, they can be really profitable. Also, these can end up being some of your best advertisements, so to speak. You know, if it really goes well, you plan it out right, and it's a great result, the patient can go away just, you know, raving about what an amazing thing you did for them. And some of these procedures can be really, I don't want to overblow it, but kind of life changing for somebody. You know, if you really change their smile. So those can be some of the upsides of these types of patients.
Yeah, and I think, and that does make you feel good. I think when you do change their smile and you can change their life, it like builds pride in a person, and you can see just a different look on their face when you see them around, and that does make you feel good because you do have a big hand in that. Well, let's move on to the next patient who is at the top of the pyramid, the pinnacle patient. Well, it's not called the pinnacle patient; it's called the regenerative patient. I'll edit this out.
Regenerative.
Let's. God, I can't even. I'm a degenerative patient. The next patient on the list is the regenerative patient, and these patients want the highest level of care. They want to be as good as new, and there's a couple of subcategories with these guys. They're either high discretionary, which is I want the best, or they're high need, like is there any hope for me? You know, they just have a bombed out mouth and they need a total reconstruction. But these patients want even better than what they were born with, and dentistry actually is, we've talked about this before, is amazing in this regard because we can actually provide people with a prosthetic or a filling or something like that is nearly as good as what they were born with. If you get a prosthetic arm or leg, you're not going to be throwing a lot of footballs. You're not going to be doing what you did before. But with teeth, you can almost do what you could do before. So, Marcus, let's start with you with the high discretionary patient. What do you see as the biggest challenge with this patient?
I think the biggest challenge with this patient is it even possible to do what they want you to do? And I think for me personally, these patients, I don't know that I have the training that I'm really capable of doing a full mouth reconstruction. You want to be real careful with how far you get into a patient like this, and you want to make sure you really understand all of the different things that are going on. I think that's where something like Spear Education and Imtiaz Manji, you know, that's where you need something like that. You really need that extra training to make sure that you're really factoring in all the different variables that are going into how the patient's mouth got the way it is. Where does the patient want their mouth to be? What are all the steps in between where it is and where they want it to be that need to be done so that it not only ends up looking good, but actually lasts and functions. So I think that's a big challenge with this type of patient.
Yeah, this is where lab communication comes into play, doing some wax-ups, doing a lot of try-ins with things, try to show pictures of, you know, what they can expect to look like. And Troy, Marcus and I know this is your bread and butter. The next one, the high-need patient, is just what you live for. The ones that the teeth are bombed out, broken down, they need full mouth rehab. How do you handle it? How much do you enjoy it?
When Frank Spear calls you, what do you tell him?
What do you tell Frank?
I tell him I need to refer him to the prosthodontist. There are some people that have really debilitated dentitions that are a very big challenge because, unfortunately, some, if not all, have monetary challenges. I mean, if you have people that don't have, or they already have dentures or something like that they need repaired, whatever. That's not a big deal. But you get a lot of times where you have people that have neglected their teeth for so long. They have root tips in there that are all decayed, abscesses, multiple teeth still need to be extracted. They have loss of vertical dimension. Those can be extremely difficult cases, financially difficult and restoratively difficult. And so, as we talked before, you have to be very, very upfront with them. And I do refer some of those to the prosthodontist if I can see that it's going to be a challenge, and see that this does, like you were saying, Marcus. Some of this stuff requires you to have additional education for. You can't just dive into this stuff and just say, "Oh yeah, I went to dental school. I made a denture once." Kind of thing, and expect to restore these folks. I mean, and plus there's a whole bunch of options, Do we restore with the implants? Do we just do a removable, There's a bunch of different things you have to go over in this type of patient.
Yeah, that's a great point. Yeah, this is where consulting with the lab, with other dentists, like you said, Troy, the prosthodontist, and when you're just getting out of dental school, this might not be something you want to tackle. And it sounds great. Somebody comes in with a $10,000 or $15,000 case, and you think, I'm all over this, I'm going to do it. And, maybe you can, but, know your limitations. I think Marcus and Troy and I have figured out what our limitations are, and we are humbled by them, but we also can appreciate them and not to go down certain paths. But, guys, where would you fall in the pyramid if you had to place yourself as one of these patients?
Wow.
This is getting tough.
I know. God.
Hey.
I thought all the tough questions were over.
Episode
13, guys. We're making it hard tonight.
I might put myself somewhere in that 3 to 4 category. I mean, I'd probably a 4. I don't know. It's tough.
Yeah.
I know. It's tough if we don't actually have to come up with all the money and the time in the chair and stuff like that. Yeah, I just thought I'd throw it.
Well, I had a bunch of my old fillings replaced with inlays and some things like that. So, I would say I'm right around 4 because I do like to look good.
Yeah,
I mean, I'm all about vain appearance. Person. You really are.
Well, and with my advanced perio disease and my bruxism, I'm probably a regenerative patient. I mean, I need full mouth rehab. So.
Yeah, that's true. That's because, dentistry does cause us to brux.
Yes.
It does. It really does. I might need to see like a TMJ specialist myself.
I wear a night guard. That's because I clench and grind at night, and it's, yeah. There's plenty of things going on in your mind at night,
Yeah, well, we appreciate everybody tuning in tonight. Marcus, why don't you tell everybody where they can find us?
I'm in Blackfoot, Idaho. Troy is... Oh, you meant...
Yeah, right.
Do not give them my address.
Yes.
You have somebody stalking you.
Yes, so you can find us on Twitter at Dental Realist. We're also on Facebook, Dental Realist. You can find our books on Facebook. You can actually get our books if you'd like to read our books at Amazon.com, the iBook store. Libsyn is where our podcast can be found. You can also find our podcast on iTunes. So we're in lots of places. If you want to get a hold of us, send us an email to dentalrealist@gmail.com. We'd love to hear any of your questions, any of your ideas for future podcasts, things that you'd like us to talk about.
All right. Well, we appreciate everybody tuning in to listen to us tonight. We will be back on episode 14 on the Dental Realist podcast. Thanks.